Thank you so much. You please sit down. As it is our practice, I want to call for prayer. Like I said before now, people say we pray a lot in Nigeria. It's part of our life, and we are a godly nation, and we continue to pray. So may I request the Vice President of the Academy and Chairman of the committee to please give us a word of prayer to start off.
Shall we pray? Our Heavenly Father, we thank you because it has pleased you to give us life. Thank you, Father, that we are here this morning. We are counted among the living. Father, we thank you because you have been with us from Monday on this program, and everything has gone well according to your own perfect plan for us. Thank you, Father, because today is the final day of our program. We commit what will happen here today to you. We have made our plans, but our plans are never perfect. Father, help us to align with your own perfect plan so that the end of this program will be a great success. Thank you, Father. In Jesus' name we have prayed. Amen.
Thank you very much, sir. You have been with us since the beginning of the program, and you are here despite the fact that you have something to do today. I know you are here physically and in spirit. Once again, I want to welcome all of you in the house. I'm happy our chairman, I was here so early, and he started the program. But that's a very good one, sir. You've taught me something again today. You know, you are chairman, just go ahead. But like I said, people like you, we have to formally welcome you before the program will start. I have quite a number of dignitaries in the house. Our keynote speaker is already in the house, Claire, and I've been chatting her. Claire, we are going to listen to you, whatever time you want to take. Please read my message. I have something to share with you. Yes, I've seen my very good friend and colleague at Coca-Cola, Pastor Dividenshaw. Nice to see you. You're welcome. Our panelists are here too. Professor Ozolua, Dr. Ikoku. I don't know what time is it now over there, around 4 a.m. But we appreciate you for being here. The moderator is here, my president, Alaji Yarobuda. Thank you. Ernest Okafo has been around all along. I've seen him. You are in two places because I know where you are now and you are here too. That's very good. Let's move on. Nick, I've seen you. We have not been seeing you for some time, but you are here. Great. Fellow Enebeli, Professor Sodipo from Maiduguri. That's really kind of you. We have been around. So let me call on Mrs. Mary Atolagbe to introduce the chairman of the day. Mrs. Atolagbe, please. Mrs. Atolagbe is the secretary of Nigerian Guild of Editors. Please unmute yourself. Good.
Good morning, everyone. And it's nice to be with you. I recognize the chairman of the occasion, the prince, and all other pharmacists and media professionals in the house. My task is to introduce the speaker, and it's in the person of Mr. Anegbe Anthony Akiotu. He's a broadcast journalist, and he has vast experience in the media industry. Mr. Tony Akiotu is simply and popularly addressed. He has distinguished himself as a broadcast manager in both the public and private sectors of the Nigerian media industry. I recall when I joined the media in the early 90s, he was already a controller with the Federal Radio Corporation of Nigeria, where he served for decades as the public sector broadcaster before he moved to the DAR Communications PLC. He is now the Chief Executive Officer, Group MD, and Director, DAR Communications PLC. Mr. Tony Akiotu is a man of many parts, I will say, because he is a fellow of the Nigerian Guild of Editors. He's not just a member, but a fellow of the Guild. And he also served that professional body as its vice president at one point in time. He's also a member of the Nigerian Union of Journalists. And I said he's a man of many parts because he has not only distinguished himself as a broadcaster, a broadcast journalist, he is also a member. He's also an astute marketer and a member of the Nigeria Institute of Marketing. Mr. Tony Akiotu was also a member of the World Association of Newspapers. I can go on, but let me just stop at this point and introduce Mr. Anegbe Anthony Akiotu, the Chief Executive Officer, Group MD, and Director, DAR Communications PLC. You're welcome, Mr. Akiotu.
Thank you very much, Mary.
You have now been called, sir. You are the chairman. So go ahead, sir.
Thank you very much. Mary makes it sound like this gentleman called Tony Akiotu has acquired the status of a Methuselah. I don't think I look as old as she makes it sound. But it's my pleasure. I have closely followed the events of the past few days, the collaboration between the Nigerian Academy of Pharmacy and the Nigerian Guild of Editors. I think we need to have more of such collaborations. People should not be shy from active collaboration with key stakeholders in the media, the Guild of Editors, the Nigerian Union of Journalists. That is how we get to know about things that are happening around us and the challenges and the various milestones and achievements by professional bodies like the Nigerian Academy of Pharmacy. I have closely followed these events to the extent that I was delighted the day my good friend and colleague, Azubike Sekwena, told me or asked if I would be disposed to being chairman of today's session. And I gave him an instant yes, because I come from a background where in the 60s, I had a late father, as it were, who worked as a pharmacist, what do they call the pharmacist technician, I think it was, in LUT, in Lagos University Teaching Hospital in the 60s, before he retired in 1978. But then that gives you an idea of the fact that I'm coming from a background of somebody who has lived with a father who has devoted some part of his life to the industry. But I have also had an interesting encounter with the subject of today's discussion, and that's the COVID-19 pandemic. I was unfortunate to be one of the victims in the early stages. That was sometime in May 2020. I had the inglorious opportunity of being one of those in the isolation center in National Hospital in Abuja. And the experience is something I don't want to recount. Unfortunately, for some of us, we are the guinea pig in the early days of the of the pandemic, because all sorts of experimentations was carried out on us in terms of medications. But we thank God for those of us who survived it, and we are not taking God's glory for granted, because the worst could have happened. I can't count how many friends I lost to COVID between then and now. But we thank God for advancement in medical science. At least there appears to be some kind of hope in the horizon. The death rate appears to be dropping, at least in this part of the world. And I think this is something to be cheerful about. The vaccines have come with their own controversies. And the controversies don't seem to have abated, depending on which part of the world you are. Whether it's the Pfizer, the Johnson & Johnson, or the Moderna, depending on which ones are available or are being dispensed to people in different parts of the country, but in different parts of the world. But essentially, they have come with their own controversies and issues. Most countries, yesterday I was following on international media, some countries have put a permanent hold on the use of AstraZeneca, which is the vaccines that we are using in this part of the world because of blood clots and other related effects from people who have taken the vaccine. I was also listening to the executive secretary of the National Primary Healthcare in Nigeria some days ago, and saying that the effects of the AstraZeneca on Nigerians has not been as devastating as it's been in some parts of the world. They've had very mild cases. No cases of deaths have been reported. But these are issues that have arisen after the, in the administration of the COVID-19 vaccines in Nigeria. But as chairman of the occasion, my job will be to call on our key speaker and other contributing speakers to give us their perspectives on the lessons of COVID-19 pandemic. And the keynote speaker today is a lady of many parts. Claire Omaseye is founder, managing director of the international award-winning company, JNC International Limited, and the current president of Healthcare Federation of Nigeria. Her company is a turnkey medical equipment solutions company founded about 15 years ago. Claire has been instrumental in the development of several healthcare policies and public procurement reforms. She is an honorary fellow of the West African College of Surgeons, fellow Pharmaceutical Society of Nigeria, among others. I can assure you that she's a lady who is going to deliver a very thought-provoking paper to us this morning. So my pleasure of meeting you for the first time, Claire, looking very bright and cheerful. Please take the floor.
Of applause for our chairman for a job well done. Thank you so very much. We appreciate you. And we certainly know that Claire will clear the way for the discussion today. I'm sure she's getting ready. But before she's come to speak,
okay,
let me call on the national chairman of Association of Lady Pharmacists, Mrs. Victoria Uko, to please introduce our keynote speaker. So. Yes, Chairman Abs, I know you are there.
Hello.
Yes, we can hear you, ma'am.
Good morning. Good morning. Thank you very much. Good morning, the chairman of the occasion, ladies and gentlemen. My duty is to introduce our keynote address speakers. I have the privilege to list Claire, Pharmacist Claire Omosheye, a fellow of the Pharmaceutical Society of Nigeria. Claire Omosheye is the founder and managing director of the international award-winning company, JNC International Limited, JNCI. She obtained a B.Pharm from Ahmadu Bello University, Zaria in 1990 and an MBA from the prestigious IESE Business School, Barcelona, and the Lagos Business School, LBS, in 1999. JNCI, a company she founded 15 years ago, is a leading turnkey medical equipment solutions company, which exclusively represents 26 global medical equipment manufacturers. Claire, as she's popularly known, is an avid advocate for healthcare reform and has used her vast 30 years provision and medical devices to inform through multi-stakeholder engagement and collaboration. This has been in the areas of public-private partnerships for healthcare, sustainable childhood immunization, public procurement reform, and policies to incentive private sector investments in healthcare to unlock the potentials of the Nigerian health sector and beyond. She serves as the Vice President, Africa Healthcare Federation, AHF, President of the West African Private Healthcare, pioneer and former President of the Healthcare Federation of Nigeria, HFN, a non-profit advocacy group that brings all stakeholders in the Nigerian private healthcare sector under one umbrella with the aim of influencing healthcare policy and practices in the country and public procurement reforms. She is the honorary fellow of the West African College of Surgeons, fellow of the Nigerian Leadership Academy, fellow of member of the Pediatric Association of Nigeria, member of the Society of Quality in Healthcare in Nigeria, member WISCA, Women in Successful Careers. She sits on the board of several reputable organizations. Claire is a He has a special and unnecessary death of women and children and reversing the plight of the upsurge of cancer in West Africa via increasing the radio diagnostic, interventional, and oncology services in the sub-region. She also enjoys engaging and mentoring the youth, empowering them with knowledge to embrace the mantle and responsibilities of steward leadership. And I want to add, she's an eloquent orator. And as Ike Onyechi said on our platform, anytime with Claire Omosheye is never wasted. So permit me, the chairman of the occasion, ladies and gentlemen, let me have introduced the lady of the moment. Let me present her, Pharmacist Claire Omosheye, a fellow of the Pharmaceutical Society of Nigeria. Thank you.
Thank you very much, Madam, for that introduction. I sincerely appreciate this very special invitation from the Nigerian Academy of Pharmacists and the Nigerian Guild of Editors. I think this is a real special occasion and rare occasion where we show that collaboration in the private sector, and more importantly in the polity, it brings about ecosystem changes. And I think that's what we've been able to achieve in this 1 week of continuous professional development and academia. So I'd like to say a very big thank you to both organizations for this very special invitation. The chairman of the occasion today, I would like to also say a big thank you too for your kind words. And I have been given the task of, I would say, kind of helping to spearhead the conversation, the discourse today on what are the lessons learned from this COVID-19 pandemic and what is the way forward. This is the outline of my presentation. So I will be talking a little bit of some of the things that, from my context, what I think we have learned, what we need to do to continue to curb the pandemic, because as you're aware, we are still in the pandemic, in the third phase or fourth phase, depending upon what part of the world you are. And finally, what's the way forward? What is, from where I sit, the recommendations on going forward? Now, I think everybody is aware that 17 months ago in China, we had the novel coronavirus that started as an epidemic, transited to a global epidemic, and today has become the new reality, absolutely disrupting the way we work, the way we think, what we do. Unprecedented times that I don't think any of us knew that even in 2021 Q2 that we would still be here. So this is really something that blindsided not only the governments, but also private and public sectors as a whole, and has led to a lot of economic distortion, and it's a big challenge. But as Winston Churchill had said, we must never let a crisis waste. For us in healthcare, this is actually a rare opportunity for us to get our voices heard. It's been a very long time that we have been pushing healthcare as something that should be on the top of the agenda. Unfortunately, governments around the world, especially in Africa, pay a lot of lip service to healthcare. And it's very important, right, that we wave this tide and we take advantage of the crisis to get our voices heard and get healthcare where it should be. We are already in the second quarter, and again, many countries around the world are shutting down. We've been watching what's going on in Europe and what's happening in Brazil, and the pandemic is ravaging a lot of people. Even in the US, where their immunizations are up to 4 million people a day, Nigeria received less than 4 million vaccines, and the US is immunizing 4 million people a day. And in some states, they are still having a third and fourth wave. So this is a big challenge. In Nigeria, and of course, this is exactly what happens in the rest of Africa, sub-Saharan Africa, we weren't prepared to tackle the pandemic, even though we had some exposure to other epidemics. For example, we had the Ebola in 2014 and 2015. But there was a lack of preparedness. We weren't self-sufficient. We're dependent on imports. There was a lot of nationalism, and people were hoarding their inventories of stock of PPEs and so on and so forth. And we can even see that right now when it comes to vaccines. A country like the US did not export anything, any of their tests, the COVID tests, and as at date, haven't done any major export of vaccines. We've been dependent on vaccines from India, China, Russia, and Europe thus far. So we also had a huge global lack of life-saving equipment and medical equipment. The demand was way more than the supply. And then we have this issue where there's a dilapidation of the healthcare infrastructure in our country. Now, although we know that the vaccines have improved the situation, and we did think that this was going to change the narrative and flatten the curve, we still have to understand that we're in the pandemic. And although there are lessons to have learned from the first 3 phases, we are still learning as we speak. So just to go through a few stats, which I would like to share, the fact that we're on the 3rd or 4th wave, depending upon where you are in the world, we've had 138 million cases, recorded over 219 countries, 2.9 million, as we speak right now, deaths due to this terrible virus. We have now in excess of 5 variants, so it's not just the original novel virus. We have over 804,000 daily cases. We have 12.9 million deaths now, just as at the day of, as at yesterday. So these are really, statistics that, as the chairman said, are disheartening. Because if you have been on the other side, like he has, and like I was, in January, I caught COVID. My daughter is a doctor in the UK, and she's been on the front line, 18 months out of medical school, right onto the front line. And she was exposed to COVID. And of course, I was caring at home. I didn't leave the house. I followed everything that happened, but myself and my family caught COVID. I don't pray for COVID for anyone. And whatever we can do in the private sector, and of course, as the Guild of Editors, to educate the populace that this is not a ghost. This is not a rich man's disease. This is a reality. We need to educate. We need to do change, behavioral change communication, and we need to take preventive action, using vaccination and other ways in which our National Primary Healthcare Development Agency and NCDC have requested us. All right. Now, this just shows, of course, where coronavirus is all over the world. And you can see Nigeria, Africa, we are also in the middle of it. Maybe not as bad as some of the developed world. I think God, as our director said, God loves Nigeria. And that's why we must continue to pray in addition to applying science and academia. But you can see there where we are still hit by this virus. And it has been a challenge because the places that we are an import-dependent nation for our drugs, for our excipients, for our raw material, for our medical equipment, and those countries that we buy from in the US and the UK and China were the worst hit. And therefore, we that were dependent on import had challenges ahead of us. So what are some of the lessons learned? What is the real reality of where we are? This slide tries to tell us, what exactly we faced. The pandemic came at huge cost to each and every one of us. It exposed the weakness in our public health system. It showed the fragmented private sector. There were a lot of MSMEs playing, but we don't have the scale. We didn't have the experience. We didn't have the isolation centers. We couldn't scale up fast. We had to go, instead of building hospitals and having proper infrastructure, to doing tents and so on and so forth. I must say that the benevolence of the private sector, the organized private sector, has been incredible. Nigerians came out and really showed that they cared. There was a lot of empathy. There was a lot of collaboration, a lot of camaraderie. And people were feeding people that couldn't get access to food or didn't have their next meals. There were hospitals being set up. There were isolation centers being set up. There were huge donations from religious organizations across the country. But the challenge was the fact that it wasn't a multi-sectoral coordination. And we need to be able to be prepared in the future, because this will not, I'm not a doomsday or a soothsayer. I pray it doesn't happen, but I don't believe this is our last pandemic. I think life probably will not get back to where we used to see it and have it. And therefore we need to learn how to work alongside it, work through it, and prevent it to the best of our ability. We saw disruptions in supply chain, as I mentioned earlier. We saw social impact. This wasn't just a health crisis. This was an economic crisis. There was a direct correlation between healthcare and economics. The lack of health, the absence of access to quality of health, automatically became an absence of economies. And of course, in a nation where over 70% of our population is below poverty, you can imagine the vicious cycle of poverty that we started. The insecurity with food, the impact on healthcare workers, the impossible, access to even care for, the non-communicable diseases. We have a lot of people who needed to get their diabetic drugs, who needed to see their doctors for cardiovascular disease, who are hypertensive, but they couldn't get access to a hospital because the private sector and the public sector were turning patients away. I personally, just like the chairman said, have lost too many people. In fact, at one stage, I just refused to pick up my phone because I said, who is it now? So we're not talking about an academic exercise. We're talking about lives that each and every one of us on this call is aware has affected us. And therefore, we cannot allow this to happen to us again and be blindsided, and we do need to have the solutions. These are two studies that were done just to show, they asked different respondents in countries across Africa and West Africa specifically. How many of you have actually gone without medical care? And just look at the numbers. So many people went without medical care, especially during this pandemic, and had no access to medicines. So we've always known as pharmacists, as journalists, as members of the populace, that access to medicines is a challenge. But in a crisis, it became worse, and unnecessary deaths pursued. When it came to the issue of lockdown, how many people were actually ready for a lockdown? Did they have running water in their houses? Did they have access to a private toilet? Did they have any savings in which they could feed themselves with? Do they have access to a radio or a TV to hear the news that our journalists were working with private sector to be able to, it wasn't there. And you can see again, all across West Africa, this was a big challenge. Most people over 50, it varied between countries, but a lot of the countries did not have any readiness to the lockdown. Now, it means for me, the first lesson is that we need to make sure that healthcare goes on the top of the agenda, and it becomes a priority. In the US and the UK, healthcare wins elections. In our country, I don't know, let me not get political, but we need to move away from what we're doing right now, which is just voting anybody, any man of the day, to ensuring that we have some low-hanging fruits that are pertinent to our sustenance. And healthcare must be top of the agenda. It's a critical need to make sure we do that. So we must make sure that healthcare goes to the top of the agenda, and we must make sure that this is the future. Now, the pandemic demonstrated to us a lot of things. It showed the inequity in the healthcare system. It showed the underfunded public and private sector, where our public sector budget was just under 500 billion, almost equivalent to the medical tourism in our nation of in excess of $1 billion annually prior to COVID, where we couldn't even access, even if you had the money, your money could not work for you. And I'm sure all of us saw that as a big issue. We also saw the fact that there was brain drain, there was patient drain. And because of this, also our medical schools, our pharmacy schools, our nursing schools were not churning out enough doctors to be able to look after that doctor to patient ratio, pharmacist to patient ratio. And therefore we must take education going forward. So everything to do with healthcare, incentives, access, local production, infrastructure, education, re-education, continuous professional development, self-sufficiency, everything is what we require. And out-of-pocket payments need to end. We need to have some kind of structured way in which we can pay for healthcare, and insurance must be something that we should ask our politicians for. The next issue, I think, is the fact that we have a lot of MSMEs in the space, and those of us in private sector, we are described as MSMEs, small and medium enterprise, and we're very fragmented. We don't have the scale. And the biggest challenge is access to finance. So we need to be able to have long-term sustainable finance. I must commend the government, because the government did intervene in the case of COVID. 100 billion naira was injected for healthcare infrastructure. But the challenge was that to be able to get to the level of going to the CBN, you still had to go through commercial banks and go through a very tedious process, of going through your credit. You needed to have the collateral. You needed to have a fantastic business plan. You needed so many things which the average entrepreneur could not make. And therefore there was limited access to this funding. We did have incentives that reduced physical and non-physical incentives, where some of the healthcare commodities were actually made a zero duty. But beyond it being an intervention, we need it to be a long-term sustainable intervention. Healthcare, we cannot pass the cost while we're still import dependent onto our patients. The out-of-pocket payment is too high. It has gone from out-of-pocket to catastrophic out-of-pocket. And we're getting more impoverished by the day. So we really need to find innovative ways to pay for healthcare systems to bring down the cost. And as we saw in COVID-19 pandemic, the first wave, we leveraged a lot on technology. Those that could not go into hospitals were seeing doctors online through telemedicine. They were being able to get their prescription filled through those pharmacies that were already doing e-commerce and had started to do that and were doing deliveries. We had existing delivery systems like Jumia and Co that were using motorcycles and delivering goods and services, now delivering food and essential drugs. So we were resilient, we were innovative, but we need to scale up on that and make that long term. Of course, the next issue is the fact that we had misalignment of the private sector and stakeholders. As I said before, we have had 2 epidemics or pandemics. This is not the first time we have experienced this. We learned a lot from Ebola, but I think somehow we have selective amnesia as a country, as a government. We choose what to remember and what to forget. We don't learn from our experiences. This is the Academy of Pharmacists. We need to document our best practices, document our systems, put them into a blueprint, and make sure that we build systems and structures and strengthen our existing healthcare systems around that. If we don't learn from the past and learn from our mistakes, we continue to repeat the same poor history that we've had. But we have also had some success. And I'm sure remember the gains that we had when it came to Ebola, but we seem to have lost it when it came to this COVID-19. So this pandemic is an addition to communicable diseases like malaria and HIV and non-communicable diseases. So it was a big challenge. Now, the big challenge we had was government's engagement with the private sector. I was the president of the Healthcare Federation in the first wave, and it took us almost 5 months to convince government to allow the private sector to come on board and assist with scaling up testing. Now we can see the involvement of the private sector. It's been very frustrating. I see somebody that's just put a post in there. It's been very frustrating for the private sector. We have a lot of innovation, a lot of ideas, a lot of efficiencies that we could quickly collaboratively come together. We could set up consortiums. No one person can do it alone, but together we can set up consortium. A provider who does logistics, a provider who does cold chain, a provider who's able to do administration. We can do these things together collaboratively. Structured partnerships are the way to go, but public-private partnership is the future, and government has to engage us. And I must encourage them, because eventually they did break through, and the DG of the Nigerian, the NCDC did an excellent job in engaging the private sector in making sure that people were accredited. The Commissioner of Health of Lagos State and Mr. Governor of Lagos State did a fantastic job in showing and being that pace setter, lifting the bar, breaking the ice, breaking the barrier, and allowing private sector on board. And you can see the efficiency in which we've gone from having 7 days for you to get a COVID-19 test, a PCR test, down to 48 hours to 24 hours, and now even 6 hours in some of the private centers. That's the efficiency of the private sector, which, with the government's hesitancy, as we are seeing with vaccines, the hesitancy to engage private sector is there. There's no private sector involvement at all in the present rollout of vaccination. And this is a missed opportunity for government. We're not asking to take over what government's responsibility is. We're asking to partner with government to strengthen government's ability and to be able to solve the challenges. Now, the big challenge is the fact that there's a difference between perception and reality. Most of us think that it's government's responsibility. The private sector is seen as a profit-making organization, and therefore, we're not a good partner. But the truth is that we need each other. Government cannot do it alone. We must do it together. Now, we have, as private sector, a few things that are making us or challenging us. The first is the fact that we're very fragmented. We need to start thinking more collaboratively. So this is a lesson learned. The way we're doing business right now is not sustainable. Most of you know me, I'm a disruption person, but I'm an innovative disruption person. If we don't disrupt ourselves, the polity will disrupt us. With technology that has come on board and people already exercising, including this meeting right now, which is being run on technology, we cannot continue to stay small. People will merge, technology will come in. We have to get out of our fragmented areas. We have to stop just thinking of ourselves as competition and become co-opetition. We need to start thinking of ourselves as a major contributor to GDP, and we can do that. In the US, healthcare is a major contributor to GDP. We need to look at the low purchasing power and find innovative ways to reduce out-of-pocket payments, and we need to be able to increase infrastructure. It is not sustainable that 70% of our drugs are imported and that we're dependent on India and China for excipients, for raw materials, for packaging materials, and finished products. And at some stage right now, there's been a ban on export, even in the vaccines as we speak. So this is not sustainable, and we need to rethink the way forward. This is just a slide I won't be able to go through for time, but this is a slide to show what private sector has been able to do in the first wave, from laboratory testing to data collection, all the way to logistic coordination and capacity building. These are the things we participated in across the sector in the first wave and that we're still doing now. We've created new jobs, but we need to document this. And I'm sure the Academy of Pharmacists and the Guild of Editors will be able to document these things. These are some of the success stories that we had, and the private sector's involvement, the lessons learned of what we did, how collectively private sector came together. CACOVID was formed by private sector's intervention. The government provided some kind of fiscal incentives with tax breaks for money that was donated. And I know that they raised in excess of 35 billion naira. With that, they were able to provide palliatives for the poor. They were able to provide isolation centers set up molecular labs, and so on and so forth. We had YPO, the Young Presidents Organization, that set up an ICU in and an isolation center in Lagos State. We had lots of collaboration. All the NNPC partners, the petroleum partners came together, donated isolation centers. There's a lot, because of time, I won't be able to go through them. A lot of things that we're doing. You know, a lot of mobile testing, innovation where mobile testing was going on. We had pharmacists that were, you know, set up e-pharmacies and e-commerce. We had Life Bank that was doing blood and started doing molecular labs. A lot has been done. We had our own NIMA that, you know, even did some gene sequencing and actually went further to check what type of COVID we had in the country. We also saw a lot more public-private partnerships. So this is what I was saying here. We saw the innovation in mobile testing. We saw real-time interactive maps where there was a lot more engagement, a lot more communication. NCDC did a brilliant job, a really brilliant job. The way they were able to scale up. Initially, we weren't prepared, but the way they were able to scale up in 3 months, go from, you know, a few laboratories in Yaba and Abuja to scale up to having regional centers, and now a lab in every state, supervising private sector and making sure all of us, you know, conform to the basic standards, and then going on to provide PPE, provide PCR kits, you know, educate us on a daily basis, work with the presidential task force, which was set up, and give us online information. I mean, that's never happened before, where government engaged us daily. And I'm sure that the Guild of Editors will agree that there's a lot to learn from that. And we had interactive maps. We could follow. Everybody was empowered with knowledge. But this is really the score that we still had. And this is not done by me. This is done by the World Health Organization, that shows what is our emergency readiness, our preparedness. So yes, you know, to prevent, detect, and respond, we still have room for development. It's a lot more capacity needs to be done, but we need to, you know, to dwell on the gains, to leverage and leapfrog on the gains that we have gotten so far and move forward. So the next one is the fact that another lesson is the fact that we need to increase on the healthcare infrastructure. You know, the 50-bed hospitals, the 100-bed hospitals, the less than 7 WHO certified laboratories to make drugs in the country, and so on and so forth. The infrastructure is too small to support 200 million Nigerians. So we need to look at that. We need to learn, you know, close it with the digital divide. There's a lot that needs to be done. We need to look at medicine security. We need to look at drug security and vaccine security. We have become an ultimate importer and consumer. So we learned from the COVID-19 that this is not sustainable. The way forward for me is that we need to have a local content law for pharmaceutical manufacturing. Even if we're 30% higher than imported goods, we should still, they should still buy Nigeria for Nigerians, by Nigerians. It is important. We need to follow the learning lessons of the oil and gas industry. We need to have self-sufficiency for raw materials, which means we need to do backward integration, research and development, API development in our universities. We need to strengthen our universities' research and development capabilities, and we need that close collaboration between the university, the academia, and the private sector, just as you've seen in all over the world. The vaccines were not developed by the pharmaceutical companies. It was collaborative efforts between academia, research and development institutes, universities, and so on and so forth. And of course, access to finance. And finally, we need to have leadership. As I said, I think we had brilliant leadership with the presidential task force in Nigeria and the DG of the National Primary Healthcare Development Agency, and now with Dr. Faisal in the National Primary Healthcare Development Agency. We are showing leadership, but we need them to be, and they were empowered, but we need them to be more collaborative with the private sector. If I look through the various countries that really made a difference, you can see, and forgive me, most of them were run by women. So there is also importance of diversity in leadership. We must empower women to come on board. And one of the things I think made a difference is the fact that women think with head and heart. And this was an emotional decision. So lots of things were the carer nature of a woman, making sure we could shut down early, understand that we had to protect the country quickly. And you can see Angela Merkel, the president of Taiwan, New Zealand, all of them acted very promptly. Now, what's the way forward? How do we continue to curb this epidemic? It's important that we follow WHO guidelines, but it's important that we build a framework that is sustainable all the way, it's all the way from following the guidelines, but making sure we have self-sustainability. Communication needs to be kept up. In our field, we call it behavioral change communication. We need to be able to make sure that people understand and keep it going. It should not stop. We need to use media, radios, telcos to keep on going. We need to have contacts and call centers. It shouldn't stop. We need that emergency preparedness must be a state of the nation. It must be beyond COVID. I hope it ends this year, but we should all be able to have some resilience built and sustainability built. We need to understand that we do not have the right number of healthcare workers in our country. There are not enough pharmacists to go around. So we need to leverage on technology to be able to close the divide. We need more pharmacists to take more responsibility. For example, with patent medicine vendors, we need to adopt some patent medicine vendors, let them work under us and get access to medicines more thorough. We need to do task shifting. There's some work that we need to give to pharmacy technicians. There's some work doctors need to give to nurses. There's some work that doctors and nurses need to give to clinical extension workers, but we need to do that training. There is no reason why pharmacists cannot do immunizations in pharmacy, but we cannot start overnight because we were not taught immunization. Those of you that have PharmDs, maybe you do, but the rest of us weren't taught immunization. We don't know where the deltoid is. Neither do we know how to handle a medical emergency when it appears. If you're in a pharmacy and you have an adverse event, what do? Do you know how to administer adrenaline and so on and so forth? We don't. So we have to be careful what we ask for. We have to be prepared in the future to be able to do this. But there's a lot that the Nigerian Academy of Pharmacy needs to teach, and there needs to be a certified course where we can prepare community pharmacists, hospital pharmacists, to be involved in the whole value chain of vaccination, for example, all the way from cold chain to distribution to administration, in line with the country's strategy and best practices, and of course, in line with what the regulators allow us to do. If you look at these numbers, we are losing doctors and nurses and pharmacists on a daily basis. At some stage, we were saying there were 6 a week. After COVID-19, even during COVID-19, we were exporting our doctors abroad. People were sending planes and going to Benin, picking up our doctors. They were giving them emergency visas in the American embassy, opening up just for this. So we have a big challenge with human capital, and we need human capital to make a difference. We need to leverage on technology. This shows the various types of technology, what's going to happen in the future. Where do we play as pharmacists in this entire area? I can just see, dosage reduction here, but we need to understand that technology is going to redefine the future. There may not even be pharmacies. There may be ATMs around the place where your drugs are dispensed. I go online, do it, and the drone will deliver my drugs. I know it sounds far-fetched, but there are lots of things that we must understand the global trends and where things are going. Remote working is another thing that we learned, and I don't think will stop. So we must understand the new way of working. The future of work is different from the way we used to know it. And we need to be prepared for that. We need to increase, there'll be a lot more working from home, a lot more of us that will have to be socially distanced. I won't be able to go through this because of time. Now, finally, I'm going to end up on ensuring how do we learn from this and ensure that we have a vaccine rollout, because you will agree that this is the biggest vaccination campaign in the history of the world that anybody, any country has ever embarked on. And in Nigeria, it's no different. So we have been given 3.9 million doses of AstraZeneca. We're a long way away from vaccinating 70% of 200 million people to get the herd immunity that is required to flatten the curve and open up Nigeria to the rest of the world and get back to near business as usual. Now, if you look at the world statistics, there are 478 million doses have been administered worldwide so far. And remember what I said, we have 3.9, we haven't even administered half. As we speak, government has stopped immunization. As at last week, Lagos State stopped yesterday. There's no more vaccination right now because we do not have enough vaccines. And the vaccines we have to be kept for the second dose. So, it means that this circa 4 million doses is only 2 million people, or 1.8 million, 1.9 million people. It's a big concern from where I sit. I spent my first 14 years of my career in the vaccine field. I set up a vaccine distribution company. But this is disruptive for me because I can't understand why private sector cannot be involved. There are people who have been paying out of pocket. We have never received Panadol from government before. They're in a position to pay for the vaccines. Government has no budget for this. We are in a position to assist, and I use the word assist and support government's efforts and not replace. And we are not taking advantage of it. Okay. Now, these are the 5 or the 6 things that we could do. But unfortunately, it's the opposite. We have a lot of challenges. There's a shortage of funds. It wasn't budgeted for. We have inadequate infrastructure, but the private sector has that, and collaboratively, we could come together. We have limited distribution and logistics, but in the private sector, as collaborators, together, we can make a difference. There needs to be more enforceability and accountability. I went for my own vaccination. It was an experience I don't really want to recall, but they had no masks, or they weren't wearing them properly. There was no mentholated spirit, and they had no gloves. I had to buy gloves and donate to the center. At the end of the day, when it was my turn to get my vaccine, they said there was no spirit, and that's the way they give. I was going to think, should I wait or not? But I just waited 2 hours in line, and I took my vaccine. But that's not the right thing. So that if the private sector was involved, even if the local pharmacy or the local hospital was supporting government's efforts in the locality, they could have paired us up as a buddy system to support each other. There's a lot that we could have done. Now, when it comes to the actual number of vaccines, as I said earlier, we are so dependent on importation. Every year we use about 1.3 billion doses of vaccines in Africa. 1.3 billion doses of vaccines are used, and Africa represents 25% of that global demand. But how many countries in Africa are actually making vaccines? So it's very important that we engage private sector in the rollout. There's a lot of data. I will share these slides. Because of time, I will not be able to go through there. But I just want to show you a few case studies of countries in Africa that are already leveraging on the private sector. So Morocco is one of those countries. They have a public strategy for administration of vaccines. They are engaging the private sector in the vaccine administration. Uganda apparently did not do it on purpose. It was accidental that they needed the vaccine, the private sector, when the vaccines from COVAX arrived. But as we speak now, they are involved. In India, where the vaccines are being made, they have also a PPP with the private sector. And you can see that you can see that on the last point there, they mobilize the private sector to administer the vaccines, and they have an innovative payback mechanism to pay back the private sector. You're there. So it's not profit making, it's a fixed price. What we're talking about is how do we get access? How do we increase access by leveraging on private sector bodies? This was, as you know, I left as the president of the Healthcare Federation. So the Healthcare Federation president today is Dr. Pamela Ajayi. She and her ESCO have been very active in the COVID-19 pandemic and the importance of getting the private sector involved, especially on vaccination. And then this table just shows the various ways in which private sector can get involved, from supply to access to finance to education and monitoring. And this presentation was made to the National Primary Healthcare Development Agency through a PPP collaboration workshop. Again, because of time, I will not be able to go through this, but it's important that we keep this message going on. These were the prayers that the Healthcare Federation of Nigeria, being the umbrella body, the advocacy, the voice of the private sector, that was very important the private sector plays a holistic role in the vaccination campaign. Very important that we leverage on the existing logistics and administration, that the private sector will complement government's efforts in post-vaccination pharmacovigilance. I know many of our hospitals, especially in the teaching hospitals, our pharmacists are involved with pharmacovigilance, but it is a push as against a pull. If I've had a side effect and I have pain on the injection site, I may not report it. In fact, I didn't report it. But if I received a phone call from a call center, or I got a text to say, do you have any adverse reactions? Say yes or no. And I say yes. And then somebody now calls me up and follows through. That is a push and pull. You cannot do this as just public sector. You need to leverage on the call centers of the HMOs. You need to leverage on the existing infrastructure. So again, there's a lot that we can do. I won't be able to go through this. Again, 99% of the vaccines in Africa are imported, and only 12 million doses are manufactured in Africa. These are the sites across Africa. Where is Nigeria? Nigeria has BioVac. biotech, biovaccines, but it hasn't started. So we really need to encourage biovaccines and any other entity that is interested in investing in this space. I know that the Aliko Dangote Foundation is interested, but we need to move it from an institutional to a pure private sector, from a private sector investment to an institutional investment where we collaboratively co-invest into this. And it is very important we do this these are the advantages when we now have self-sufficiency on the continent. You know, with the AFTA, the recent African Free Trade Zone, we could be a net exporter. It will earn us foreign exchange. You can see our foreign exchange earnings are dwindling. There's so many advantages and benefits. Increasing public health resilience, secure our supply, have medicine security, vaccine security, reduce our strain on foreign exchange, and so on and so forth. There are various barriers for manufacturing, and I think the biggest one is the lack of vision. That we think short term, we think now. Everything is now, and rush. We don't plan. We don't have a medium to long-term strategic plan for a public-private partnership. There's a lot of lip service. Can we move from lip service, from talk to walk? You know, so these are some of the things that we need. We need to build the skill sets. So our universities need to start building that opportunity for biotechnology. We're not there. Again, look at where we are in terms of access to vaccines. We are probably not going to get all the vaccines we want. Africa will not get the vaccines until 2023. This is unfair and unfair and not sustainable. So there's a lot of learning lessons, but it is not sustainable for us to continue to import vaccines. And these are the AUs and the Africa CDC. Again, something good came out of this COVID pandemic. We have now institutionalized the African CDC, Center for Disease Control, and they have close collaborations with the individual countries' CDC, RNCDC. But these are some of the aspirations for 2040. Not far away from now, just under 20 years from now, to be able to have fill and finish of vaccines in the country. So we don't even need to do all the vaccine development in country. We can buy off, Serum Institute of India, anybody else, and finish here in country. Buy in bulk, fill and finish, label, package, and distribute, not only to Nigeria, but also to West Africa. And these are some other things that we need to do. Eventually get to routine immunization. We need to be able to invest in STEM, science and technology. We need to invest in research. Our research and development is suboptimal. Our government has to put their money where their mouth is. Our researchers need to be able to leverage on the opportunity right now. There's a lot of grants in millions of dollars available from the African Development Bank, the Afrexim Bank, the Bill and Melinda Gates Foundation. There's a lot of money out there. We need to be able to get that. And then finally, we now look at the issues to tackle. I won't go through this right now, but there's a lot that needs to be done here. We need to accelerate. Now, just to close up this, because I think I've overstepped my time. I think for us in the healthcare space, and especially as pharmacists, that COVID-19 has given us a unique opportunity to scale up, to accelerate the importance and the unique importance of having access to quality healthcare. We need to take advantage of the new AFTA laws and make ourselves self-sufficient. We need to become a major distributor, a major contributor to GDP. And we can only do this by collaboration, strategic partnership with the public sector, government creating that enabling environment, giving us the physical and non-physical incentives, and for us to make a difference. This pandemic should not go to waste. We can't waste this crisis. We have to take actions. And that is why we need to work with healthcare federations, like the Healthcare Federation of Nigeria, like the Academy of Pharmacists, like the Guild of Editors, to be able to unify, build capacity. We need to share knowledge. We need to advocate, coordinate, and build those partnerships, and that will make a difference. We need to shape the future of health, the future of work, develop 21st century skill sets, which are not what we have right now. We need to reimagine medical education, and the future is in our hands. The future is in our limits. As my final words, doing nothing is not an option. So this is my charge to all of us on the call. Let us make a difference in healthcare. Let us make a difference in our country, in West Africa and Africa. Let us put Africa on the map and get access to quality healthcare. Thank you very much.
Wow. Wow. Thank you so very much. Yeah, even before now, everybody was saying it, that with Claire, there will be no dull moment. Claire will clear the way. And I think you have cleared the way now for the discussion that will follow. With the permission of the chairman, kindly let me call on the Vice President of the Nigeria Academy of Pharmacy and the chairman of the organizing committee, Sir Ifeanyi Atoyi. He has a message for us before we go for another assignment. Thank you, sir. Technical issues.
Thank you very much, Lulu. It is necessary that I be out in a few minutes' time for a very important matter, and I am not sure I can meet the session before we close. So let me see this opportunity to appreciate some who have made this program successful. We have our technical director here, pharmacist Raji Kabiru. Some do not know that he's a pharmacist, but he has been working smoothly on the technical side. In fact, a few years I met him, I knew he's a pharmacist. I was very glad. And he said I was his role model, that he wanted to have a second profession, as I have. Thank you, Raji, for this performance. This venue we are using is Business School Netherlands, of which Professor Lere Bader is director. This is where he has been given the Nigeria Academy of Pharmacy for our meetings. And he has dedicated this week for our program. So we want to thank him. Each time we are here for our meetings of Academy, he takes care of us. And this whole week running, sacrifice to NAPHARM. So on your behalf, I want to thank Professor Lere Bader for his generosity. This committee comprises a large number of people. And because some may be thinking that we are all fellows of the academy, I tell you, there are only few of us who are fellows. The bulk of the committee comprises non-fellows who have volunteered to serve. Without them, we could not have been running this program. This is the principle which our president has adopted, that there's always teamwork. I can't give their names, but their names will be documented. And because of the COVID, we have made it online throughout the meetings. In fact, I have not met them up to this moment. We have been working online. So on your behalf, I want to appreciate them. They have done very well. Some professors, some practitioners, they have been so kind. And in fact, one is from UK. We appreciate all of them. Among the members of the committee, I want to give special thanks to Azu, who is representing the NGE in all our meetings. Azu is a group managing director of leadership newspapers in Abuja, but he has been wonderful. And his president, Issa Mustafa, they have made a lot of contributions, and they influence the Guild of Editors positively. Through them, we are getting the desired publicity. I must say a word about the director of programs, Olu Ojo. In fact, somebody remarked yesterday that he was looking so robust and so healthy. I don't know whether hard work is making him look healthier. Each time, he spends a lot of time, especially this week, and throughout the period we are preparing. So, Olu Ojo, please, special thanks to you. I think without you, I don't know what we could have done. Even though Julie is the president of Nigeria Academy, I must give special appreciation to him because a lot of the ideas have come from him. In fact, when he mentioned bringing the Guild of Editors, I was asking for what? But we have now seen the wonderful benefits of this collaboration. This is run in partnership with the Guild, and we have seen the good results obtained. The president is a special gift to the profession of pharmacy, and I don't know how to describe him, but those of us who have the privilege of sitting near him know more about him. And there are so many things we are picking up from him. He's an orator. In fact, sometimes he can make a speech of 40 minutes. And at the end of it, reporters will come for the paper, only to discover that he was speaking from handwritten notes before him. He has no paper to present, but the presentation will receive a standing ovation. Some of you there will see him and know that he's wearing white. But when you are close to him, you know that it is not just white, it is immaculate white. I tried to make white at one time, but I found it's not possible. You can't imitate him. So let me thank, on your behalf, especially those who are not fellows of the Academy, but they have helped to run this program. Their names will be listed sometime. Our work has not ended. We have a lot to do. At the end of this meeting today, we shall fix a time for follow-up. We shall need an important document. As we said, government must get document from this program. It's a program, type of program that has never been had in Nigeria. 6 good days we have been on, and we have wonderful materials. So the committee will continue its work at the end of this meeting today. Thank you very much. God will bless you. Since we are not paying you, God will reward you. God will bless you with good health and prosperity. Thank you very much.
Thank you very much, sir. The Vice President of the Academy and the Chairman of the Planning Committee. With the kind permission of the Chairman, I think we proceed to the next stage. Let me call on Pharmacist Diana Oko to introduce the moderator and the panelists. Diana, you're in the house?
Yes, sir. Thank you very much, sir.
Go ahead. You have 3 minutes.
Today is day 6 and is the grand finale of the NAPHARM NG collaboration on COVID-19. And we have none other as our moderator than Alhaji Pharmacist Mohammed Yarobuda, FPSN, FPC Farm, FNAPHARM, MNI. Alhaji Yarobuda is a pharmacist of known mean repute. He is a past president of PSN. He's chairman of Osborne K Pharmacy Limited, a pharmacy located in Kaduna. He's an agri-investor and chairman Nia Farm Group Limited, makers of Farm Pride yogurts. Alhaji Mohammed Yarobuda is a philanthropist in education and an alumnus of the Lagos Business School. You're welcome, sir. On the panel, we have Dr. Sam Ikoku. Dr. Sam Ikoku is a doctor of business administration. He is the managing consultant and CEO of Nakachi Consulting, a productivity consulting firm based in Abuja. He is a serial investor and a renowned public speaker and author with keen interest on how technology impacts insurance, healthcare, and other sectors. You are welcome, Dr. Sam Ikoku. Panelist 2 is Professor Ray Ozoloa, my lecturer. Professor Ray Ozolwa is a professor of pharmacology and toxicology at the University of Benin. He has presented many papers in different countries and has been a guest of the Physiological
All right. Thank you, Diana, for hiding your face.
Society of the United Kingdom. Begin to go through his resume. Welcome, Prof. I'm not hiding it. You're welcome, sirs. Please, the floor is all yours.
Thank you. You see, your introduction could have been much brighter if you have shown your face earlier. All right, thank you. Yes, my president, Alhaji Yarubuda, over to you, sir.
Thank you very much, Dr. Lulu. Speaking from Kaduna here, up in the north, where it is still very hot and no rains. I recognize my president for life, president of the Nigerian Academy of Pharmacy, Prince Julius Adelusi Adelui. We are all his disciples, and what we've learned from him has been enormous over the years. And this ingenious arrangement has been fantastic as I followed some of the activities. Let me also specially recognize the keynote address speaker, pharmacist Claire Omashe. She is the disruptor in chief. And I'm glad that she's the disruptor in chief provided to all of you from our university, Ahmadu Bello University, because we studied in the same university, maybe not at the same time. Claire, you're always wonderful, and you have set the stage. I recognize the panelists too. Dr. Sami Kuku, some who do not know him, he's been, if you know Dr. Maggie Ibu, pharmacist, is her brother. So he's a pharmacist by association. Then Ray, Professor Ray, a good friend of mine from UniBen, and Mr. Akin Adewo, a media consultant. Now, the guideline would be, I'll just make a short comment. The guideline would be
You are muted, Mr. President. Please unmute yourself.
Oh, sorry about that. Can you hear me now? I don't know when you lost me. I said the guideline would be, we'll give 5 minutes to the panelists to make their contributions. And then we'll see if there will be further rounds. We'll take some questions if possible, time permitting. Let me say clearly that Claire has cleared the stage. I, just like the chairman and Claire, is a COVID survivor. I had COVID in January, but I self-isolated. And in March, I also had my vaccination. Sadly, 9 of my household members who were opportune to have the vaccination refused, because maybe they thought I'm a big man, they should come to my house and give me the vaccination. So we had 10 doses to be administered, allocated to my household, but I was the only one who took it. The rest refused. So these are some of the challenges that I see. And so I have been the guinea pig, and I'm grateful I've taken it. I've not been able to convince even my household. My wife is the chief anti-vaccine protagonist. So I guess in addition to all the things that Claire has said, it is important that we find ways, at least maybe from the speakers, to see how we can remove some of this apathy, particularly to treatment and vaccination. And like Claire has said, pandemics will come. This one was really disruptive across the world. So if there are ways and recommendations and commentaries that will help, we would like to hear it. So I start right away by calling on the first panelist, and that is Dr. Sam Ikoku. The floor will be yours, and so we'll listen to you.
Thank you very much indeed. Like they say, all protocols observed. I have been extremely impressed by the quality of the work done in the last 1 week. I think this would be a model for all sectors to engage with the public and government to make sure that, like our first keynote speaker said, quoting Churchill, no crisis is allowed to waste. I think Pharmacist Claire has covered literally every area that there is. My contribution would be to emphasize just a few areas, and hopefully we can take questions to deepen that and probably also keep this dialogue going even after this event. Of great importance to me is the ethical issues which have to be addressed. One of the things we learned from this pandemic is that universal human rights has taken a big hit indeed. Where fighting viruses of mass destruction are concerned, not all men are treated equal. There were questions that have to be addressed even after this. Who gets vaccinated first and why? How would that have changed if different groups were affected differently? Since pandemics will always be with us and occur with shorter cycles within shorter cycles, should we heave a sigh of relief and wait for the next pandemic, or keep this debate alive? This is critical. And we also have to look at the pharmaceutical development process in the new era. How sacrosanct is it? We saw emergency use authorization and the willingness in the face of large death counts to put lives at risk to save the many. It's akin to firemen lighting fires to put out larger fires. What has the pharmaceutical and entire medical community learned? And how can we keep this debate going to better prepare for the next pandemic? What is the pharmaceutical community's contribution to the debate between science and religion? We see a resistance to the vaccine from religious quarters. How can the pharmaceutical community drive into pandemic debate and community education to ensure better community responses in the future? Where VMDs are concerned, zealots may mar international efforts with consequences for the human race. The other issue I think we should continue debating is, should we willfully reduce full regulation of pharmaceutical outlets around the country? It's obvious that poor regulation allows for prescription drugs to be sold over the counter around the country. It is also obvious that access to some of these drugs, like chloroquine, ivermectin, might have saved hundreds, if not thousands of lives. How having hundreds of thousands of registered and unregistered pharmaceutical outlets around the country equals or ensures equal access to these drugs by all. There is a correlation between regulation and higher prices, so these unregulated outlets allowed for uniform distribution and lower prices. What conversations can we as a community have around this issue to enhance health security in future pandemics? I personally believe that these issues must be addressed, and using this pandemic to frontline these discussions is a good way to prepare all of us for the next. Like our keynote speaker said, unfortunately, it we're going to have more pandemics. That's just the way it works. We should be able to look at early response, but we don't have much time for that. I think our keynote speaker also covered some of that. And we must pay attention to procurement because we are import dependent. We have to understand the politics of developing countries and their health security policies, stated or unstated. We have to also understand the unfairness of aid and the consequences for health security if we do not go into manufacturing, research, and funding. As of yesterday, 16th of April, India has prohibited exports of the drug remdesivir used to treat COVID-19 as the country registered a record number of daily new coronavirus cases. In America, the White House just yesterday also released $1.7 billion just to fight the variants of the coronavirus. It is obvious that when push comes to shove, Nigeria will be left heading toward a precipitous waterfall without a paddle. What is the pharmaceutical community doing or going to do to avoid a global nationalist health emergency? We also have to look at the lessons learned and the role of sovereign funds in global health security. Many countries were able to mobilize their sovereign funds to purchase vaccines on time. We need to learn that while the private sector, public sector, other funding mechanisms are in place, one of the priorities of our national sovereign investment authority should be applied towards things like this. Logistics was an issue as well. We need specialized facilities. Most of the drugs for vaccination they are climate controlled. So we need to look at strategic zonal, transitional, and retail storage facilities for the future and pursue sector-specific funding. We have to look at distribution, cold chains, inventory management, warehousing, aggregation, to last mile delivery. Again, sector-specific funding is required. I heard some of the pharmacists talk about administering the vaccines. And even if we had enough of those vaccines, like the keynote speaker said, can we handle adverse reactions? Do we have the network to monitor deployment and all those contraindications around the country? There's a lot of work that needs to be done. And I think we as, I say we because I think I'm a part of this community now, must continue to look at ways to better prepare for the future. One of the advice I could give here would be that distribution and storage should be classified as infrastructure. And if we do that, all the pharmaceutical groups in the country can lobby to have this storage and distribution infrastructure included in the recently created InfraCorp. That's an organization set up by Central Bank, Africa Finance Corporation, and the Nigerian Sovereign Investment Authority to invest long-term in infrastructure. I think there should be a lobby group to pursue this as a matter of urgency. I also think that there should be a codification as an emergency protocol. We heaved the sigh of relief when Ebola passed us by. We seem to take all of these things for granted. Once again, we are taking all we know about the COVID-19 pandemic from international media mostly, and research sources and big data from all over the world. It's time to have a hard-headed debate and come up with levels of emergency protocol in the health sector. Like it or not, this has become an index of national development. There's so much to be said, interagency debriefs, we have a lot of fragmentation. What have we learned from NACA, from NIPRD, from NPI, from primary healthcare, from NHIS, from NCDT, from NAFTA? Why don't we keep the debate going so that we can have homogeneity in knowledge so that we are all better prepared for future pandemics. Pharmaceutical research is a must. It should be well funded. But then I think a critical thing is access to funding for local research and manufacture. I had cause to interact with the National Institute of Pharmaceutical Research and Development late last year. They had been in the media saying they couldn't find funding and support. So I decided to assist with funding because I run a private equity firm. But we needed government support to be sure that there's a cashman market. You know, this money has to be gotten back. Even if it's without profit, investment has to be gotten back. And I think you can guess how that really turned out. We need to address those issues now so that we can move forward. And when it comes to manufacturing, we have to understand that it's time to really get some GMP certification. Yeah.
Hello, Sam. We passed the 5 minutes.
Okay, fine. So basically, what?
So we'll have questions. Yeah.
Yeah. Basically, I think we should look at ways to bring in venture capital, bring in private equity, bring in long-term funding, help pharmacists, MSMEs understand initial public offerings so that we can strengthen the capital base of the private sector, because like it or not, we have a role to play. So this is my contributions, and I think we should include these issues in the debates going forward. Thank you very much.
Thank you very much, Dr. Sam. Pretty well said. So now we'll listen to Professor Rio Zolwa. The floor is yours for 5 minutes.
Can you hear me, sir?
Yes, you're clear.
You can hear. Oh, you can hear me. Yeah. Well, let me start by thanking you, Chairman. You know, I have enduring respect for you, except that you haven't taught me how to be handsome as you are, as prosperous as you are. And my respect to our revered father in the profession, Prince Julius Adeluyi. We greet you, sir. I also want to thank the ancient and modern of pharmacy practice in Nigeria. I also want to thank the most courageous group, the media, aside the military, the most courageous group that I know. They can say whatever they want to say, and they go scot-free, maybe followed by the academia. Now, there are a few things, and I think that the keynote address speaker has done justice to this topic. I just don't know what else to add. But maybe I should start from my own constituency, which is the educational system. The pandemic took the educational system and indeed the whole world by surprise. And as a quick response to the rising infections and deaths, lockdowns were declared by various countries, thereby forcing staff and students to go home. And in the more technologically advanced countries, virtual or online lectures replaced physical ones. Specifically, universities have had to alter their programs. Semesters have been shortened and sessions have been cancelled by some universities. As a result, the quantum of knowledge available to students seems to me to have been reduced, and methods of examining students have tilted towards the use of technology. A key question that seems to be arising from all of this is whether physical lectures will still be necessary for some of the courses. Now, with respect to lessons that have been learned, in terms of research, universities and then research institutes as well, the pandemic has taught us that our research capacity and capability are very weak, due largely to poor funding that some other persons have highlighted. Nigerian researchers have not been able to match at the same pace as their counterparts in the developed parts of the world. For example, we have relied on drugs and vaccines produced by other countries. The earlier we take basic and applied research seriously, the better for our nation. That is one way to guarantee medicine security. One of attitudes towards technological development. Nigerians are always very excited about new technologies, but we are not in the radar of the countries that are developing them. Our attitude seems to be one of ectoparasitism, importers, consumers, rather than being producers, exporters. Of course, the drugs and vaccines being deployed for COVID-19 are produced through technology. They are products of technology. The reason is that the world is not waiting for us technologically, and we must realize this. We must begin to activate technological development to meet our own needs. I'm also looking at the aspects of cooperation between agencies and the different cadres of healthcare workers. And the pandemic has taught us that interagency, interprofessional cooperation is necessary to improve healthcare delivery in Nigeria and indeed anywhere. The virus is a common foe. Cooperation between the National Primary Healthcare Development Agency, the Nigerian Center for Disease Control, National Agency for Food and Drug Administration and Control, and others seems to me to be very great. So simply, the lesson is that unhealthy rivalry should not be allowed to raise its head among healthcare agencies and healthcare workers if we are to make progress as a people. Now, local manufacturing, particularly vaccine production. Our manufacturing capacity has been seen in the production of hand sanitizers, washing soaps, and other non-pharmaceutical requirements for fighting the virus. We have now learned that given the necessary impetus, local manufacturing can be boosted. We have taken more interest in our medicinal plants as well. Our zero capacity for the production of vaccine has been exposed. We must start right away to put whatever is necessary in place to start the production of vaccines for COVID-19 and other vaccine preventable diseases. Necessity, I'm told, is the mother of invention. Now is the time to start. Within the next few years, Nigeria should be able to complement the effort of the Global Alliance for Vaccines and Immunization, Gavi. Management practice is something that I think has also been exposed. Lacuna, yawning gaps, has been revealed in our health management practices. All the steps necessary for the attainment of the goals of reducing the infection were initially very slow in coming, but they have now been well established. Going forward, there should be a standard operating procedure. I've not seen this. Standard operating procedure, SOP, for dealing with situations like COVID. It is expected that the SOP will be rehearsed by all agencies and should be in the gray matter, the mind of every health worker. So that whenever an emergency presents itself, everyone knows what to do from point A to point B. Now, what do we need to learn or to do for a better outcome subsequently? With respect to COVID-19.
Ray, round up, please.
Oh, yes, I'm going to round up now. With respect to COVID-19, we need to intensify information on preventive measures, but much more on the need to take the vaccine. The media must help fight pseudoscience, possibly by donating space for scientific information on the vaccine. This is one credible way to fight the pseudoscience that is out there. A lot of persons, including Chama, has owned up to say that people are tardy about taking the vaccine. And somebody has written here that many persons in this audience, as we speak, are not even convinced about the infection, let alone wanting to take the vaccine. We must remember that there will always be pandemics. There were pandemics before COVID-19, and it is safe for us to think that there will be pandemic after now. We don't know when. This is the sad reality. Virulent strains of microorganisms, as I know, may come from deliberate or accidental laboratory activities, right? The strains may be zoonotic as well, may come from animals, maybe done by mischievous scientists who just want to cause chaos in the world. The measures being currently taken in addition to strengthening our capacity for drugs and vaccine production will place us, in my opinion, in a better position to deal with pandemic or epidemic whenever they arise. I think that these are my thoughts for now, and I suppose that questions will arise, and then we will deal with them as they come. Thank you, Chairman.
Thank you very much, Professor Ray Izolwa. The third and last of the panelists, Mr. Gabriel Akinadeo.
My president, Gabriel is not here.
Oh, he is not.
He's
is there
not,
an alternative?
No representative.
Okay, fine. So let's and Dr. Lulu, perhaps you can recognize some people for some questions for the keynote speaker and the panelist. So go ahead.
Thank you so much, sir. Great job. For the moderator and the panelists, unlike before, there wasn't so much questions today, but I want to recognize 3 people to talk to us in terms of what we need to do. We have a constant royalty in the system, the house. That's the Emir of Bugundu, Alaji Hassan Bugundu. We appreciate you, sir. Almost 3 days now you have been with us. And within 1 minute, I know you would like to speak to us. There will be 2 others, after which I will call on Claire to say 1 or 2 things more. Then it will be the chairman to look at what we have been doing since. Then finally, the president of the academy will speak to us. The Emir of Bugundu, Your Royal Highness, the floor is yours now, sir. 1 minute, sir. You can unmute yourself, sir. Your Royal Highness, please unmute and speak to us. Okay, maybe while we are waiting for the Royal Highness to do that, I have a new friend now since we started this program, and that's Biodun Fasimi, who from what he has been writing today has become an apostle of this program. So Biodun, you have 1 minute to speak to us.
Thank you very much. Sorry, I'm actually driving, so I had to park so I could participate in the program. And I'd like to thank everyone for this wonderful program. It's been very insightful, standing on all existing protocols, because I have just 1 minute. Now, I had some questions I wanted to ask yesterday, and also I have a few things I would like to say, because we're looking at what's the way forward. So firstly, I was going to ask the NAFDAC DG yesterday about our pre and post market validation procedures in a time when we are having emergency use. You see, because this is very important. I'm aware of, I speak to people at the infectious disease lab in Abuja. I'm an investigative researcher, I'm a writer, and I like to make my own research to know what exactly is happening. So I speak to people at the laboratory, at the infectious disease lab in Durham in Abuja, and I'm asking about these things. And I can tell you that this question that I'm asking, it came from there. What is the pre and post market validation procedures in a time of emergency use? Are we having executive waivers override our standard operating procedures when we bring in test kits, when we bring in vaccines? You know, because it's very possible that there are certain processes that are being overlooked that may eventually become cases of national disaster. So I really wanted to ask that question. Then secondly, I was going to talk about the role of research and development, which we have had in this conversation today already. Research and development is key. Education is key. I'm not talking about the education that I was told that Mongo Park discovered the River Niger. That's not the education I'm talking about. That's the education that was given to us by the international community. And we all sitting here in this media chat, we all know that Mongo Park did not discover the River Niger. So I'm not talking about what was fed to us. I'm talking about our own education in Nigeria. We have indigenous tradomedical doctors. We have people who are coming up with solutions. How are we creating science and knowledge from it so that we can have our own solutions in Africa? We cannot rely on the international community for everything, because I'm talking about trade wars. Trade wars are going on. They loan you 400 billion, and at the same time, they take measures against us that increase the value of their currency against us, and we are not able to pay these debts. So if we keep importing everything from knowledge to drugs to vaccines, we are putting ourselves in precarious positions in Africa. And this is why we're having this conversation. What are our youths engaging in? They're engaging at the moment all sorts of songs, music here and there. Everybody wants to be a Whiskey, a Davido. How many people want to become researchers? How many people are really thinking about developing our countries? How exciting is it for any Nigerian to want to become what we are today, pharmacists, media practitioners, or researchers?
Yeah,
I was in South Africa. I'm rounding up now. I was in South Africa just a few months ago, and at the embassy, almost every application I was looking at there were Nigerian doctors. What is going on in this country? How can we provide ample data and documents and solutions to our government to improve Nigeria? The pandemic has been an exam of our development in this country, and for the least, to say the least, it is embarrassing that North Korea would make a comment about Nigeria, that if they take over Nigeria, they will help Nigeria bring out the best in Nigeria. And we all kept quiet about that. Nigeria is you, Nigeria is me, and the solution to Nigeria, we are the solution. So besides taking the conversation away from whether we should use the vaccines given to us or not, where is our own development in Nigeria, and how are we making Nigeria work within ourselves? Thank you very much.
Thank you very much, Biodun. Let me assure you of one thing. You put these questions on the platform yesterday, and I sent them to Madam DG of NAFDAC, and I just saw now that she has replied. Do me a favor, please, just drop your number in there so that I can send it to you, but be assured that part of the post-program action will be sending all this to the Nigeria Guild of Editors where it can be accessed. The point I'm making is that we're already attending to what you said. But the chairman, the keynote speaker, the moderator, they may have one or two things to say more about what you have mentioned. We have in the house a dear lady, Ajia Zainab Sarif. Are you still in there?
Okay. Okay, madam.
Ajia Zainab? Ajia Zainab, are you there? She's the director of herbal medicine at the Federal Ministry of Health. I would have loved her to speak to us, but it's like she has left. So I'm back to the... Oh,
thank
you're there.
Lolo Oju, I'm gladly listening. Thank you.
Good. Say a word to us in 1 minute.
Yes, I am. I'm gladly listening to all the comments.
Oh, okay.
Thank you very much for this conversation. I have listened very attentively, and I just want to say that I pray for another opportunity to talk, to be able to analyze issues very, very dear to us. I want to concur with the last speaker. You need to know what the Ministry of Health has done in terms of COVID-19, but with time, because today is not the time. But I want to tell you that we can never, ever grow if we do not look at our own and develop our own. The area of research and development must be significant and specified. And I have advocated for research and development in 2 stages. National research for the benefit of our people. Then international research when we can go the other way because of a lot of politics. But if we do national research for our own people, then we take it to the next level. This is what China has done. This is what India has done. We have low-hanging fruits in medicinal plants. You know, I can say that any day, anytime. Policies in government, I like he said about the pharmacists, I was during the time of pandemic, I wanted especially PSN to be more active because there were a lot of issues, especially with the issue of chloroquine. We cannot leave it to NAFDAC. We needed to synergize. At TMC meeting, every time we do have what we called situation report every day. And then my minister was able to set up a committee advisory committee on COVID-19 has strategically said, what of the aspect of medicines? I was told that medicine can only be determined by the consultants. I said, no, sir. Medicine is determined by pharmacists. But we needed to say more. And I thank you for bringing in the media. It is time to talk our own, to sell our own in line of who we are. But I'm an advocate restructuring the science in COVID-19, not only COVID-19, even beyond other diseases. COVID-19 has taught us to be able to reorganize science to meet our own people. And then we can now go internationally. If you jump and say you are going
Ajay, it appears we have missed you. Okay. But I think your point has been made. We will have opportunity of further engagement, I'm sure. Let me call on His Royal Highness, the Emir of Bugundu. Please unmute yourself and speak to us.
Thank you for this opportunity once again. I'd like to recognize all the eminent personalities here and thank them very much for this discourse. No doubt the pandemic has taught us a lot of lessons. It has exposed our weaknesses, as has been said. And I had thought that we will use this opportunity to strengthen our institutions and to find out how we could improve the way of doing things. I'm sure some strides have been made. I wouldn't say they haven't, because I've seen some little things being done, but actually I expected much more than what I have seen. I would like to emphasize the issue of getting these things to the grassroots, as I did yesterday. A lot of things we discuss here are moved in by people who are very eminent, who are very powerful in our societies, who have links with institutions which can move these things down to the grassroots. You are always as good as your society. No matter how important or how good you are nationally or internationally, you cannot be better than the society you come from. So if we cannot find a way of getting these things down and for the betterment of society, I think we really need to get our acts together. There's no point being the ostrich and thinking that we can be good without the society as a whole. So I hope this discourse here, which I think I have found very beneficial, will find a way of passing these things down, because that's really what's important. If we are not able to do this, whatever we do here, I think will have little impact to the generality of our society. I have found this discourse very, very valuable and very useful. I've learned a lot of things, and it has taught me a lot about the profession, though I think the pharmacists are taking the stage, but I think the whole medical field, I think, has really done a lot in the COVID pandemic, and I'm sure we'll move forward better than what before the pandemic. Thank you very much.
Thank you so much, sir. Let me say again that we appreciate your royal presence. Since 2 days ago, you have added value to what we have been doing. My boss, Azu, are you in the house? Just to confirm, please send me a note to confirm that you're in the house. Meanwhile, let me call on our keynote speaker, Claire, to say something, some roundup messages.
Thank you very much. Before I start, let me also recognize Prince Adelusi in the house. I didn't know he was there when I was speaking earlier. Much respect, sir. Thank you very much for the invitation, and most importantly, for putting this together. You know, one of the things we've learned in this session in the last 6 days is the importance of vision. And then after somebody has one vision, sharing that vision, and we all key into it. And I think we've seen it clearly demonstrated over the last week. And when we talk about the lessons learned from COVID-19, it starts for me with vision. Where do we see ourselves in the next 3, 5, 10 years? We need to have a short-term, medium-term, and long-term strategic plan. And we must have our voices heard. I say to people that if you are not at the table when the decisions are being made, they're on the menu. So we cannot afford to be on the menu and policies, inconsistent policies, continue to pervade our land, pervade our businesses, and pervade our sustenance and the sustainability, and most importantly, access to quality healthcare. So I think as the Nigerian Academy of Pharmacists and Guild of Editors, obviously your communique is very important, but beyond the communique and all the questions that some of our colleagues have asked here today, and fantastic points raised by the various panelists and the chairman, it is important that we walk the talk. So there's a lot of talking in Nigeria and not a lot of walking. How do we make sure that we become a rallying body? We become that place where there's knowledge share. We are advocates, we are collaborators. I think the strategic collaboration between the two parties here that have put this together is a commendable effort. Don't let it end at this webinar. Let there be constant collaboration, but more importantly, bring others on board. Bring in the Nigerian Bar Association, medical legal issues. Bring in the Bankers Committee because access to finance is a big issue. Bring on the Healthcare Federation because you have to collectively influence policies and advocacy has to be done jointly. What policies do we need in place to be able to unlock the potentials of the private sector? How do we become self-sustainable? How do we get research and development where it is? How do we get local manufacture of drugs, of consumables, of vaccines? How do we become self-sustainable and not be a net importer? As you heard many speakers say today, we have two issues that they didn't really exist prior to the last year. And in the last few weeks, it has gone worse. I call them vaccine nationalism, where people have, whoever it is, whichever country has made the vaccine, kind of owns the vaccine and does not share with anyone else. And they are now putting export bans on these vaccines. And you heard one of our speakers say, they put a drug export now. You cannot export certain drugs that are life-saving. And we are a net importer. So where do we see ourselves if we continue to think this way? So I think, the Pharmaceutical Society, the Academy of Pharmacists, healthcare, the whole continuum of healthcare, all the various associations need to speak with one voice. We need to engage government collectively on some quick wins that we want. We need to advise government short, medium, and long term. Don't wait for government to do these policies. Let us be the think tank, the go-to. Let's do the NASG of healthcare. That's what we need to do. We need to create the enabling environment, co-create together what we see ourselves, look at the key factors that must be tackled and engage the right people. Access to finance has been a big challenge for us in the pharmaceutical industry and healthcare industry, but there is a lot of financing out there. How do we lower the barrier to entry? How do we make sure that we collaboratively have institutionalized factories that are WHO certified? How do we put ourselves on the map and leverage on new policies like AFTA, the African Free Trade Zone? How do we do that? Now, it can only be done by these collective strategic partnerships, which you have already started. But let's make sure that the white paper, let's not even do just a position paper. We do the position paper, but we do several white papers. And we get endorsements from other influential associations across the country. And we keep this going until we get the results that we want. Capacity building, institutional strengthening, health system strengthening. These are buzzwords that we hear all the time. But quite frankly, nothing comes out of it. So let's move away from the rhetoric into action. Let's ensure that we leverage on innovation. We think out of the box and we think innovatively. Most of us on this call survived 2020 on resilience, on innovation, of thinking of new products and services that we can do, doing things differently. It doesn't need to be a complete wow effect. And I think with everything we've learned today, not to repeat again, research and development is critical. And self-sustainability as a country. We have to have medicine security. And we can only do this if we put all our ducks in the row with the right enabling policy, the right access to finance, with the right policies that buy Nigeria for Nigeria. Put our money where our mouth is. And I think the sky is our limit. So thank you very much, ladies and gentlemen. And thank you for your various comments. I sincerely appreciate that. And to the organizers, well done for this fantastic session that has been mind-boggling. And I think we've also gained the opportunity of zooming it on and putting it on YouTube. So we must also monitor and do the analytics and ensure that there's optimization so people around the world get to hear what you have and achieved today. Thank you very much.
Wonderful. Thanks, Claire. You've done well. What I want everybody to know that all these points being put on the table will be packaged and submitted to the right quarter. That we will do, I can assure you. Let me call on Alhaji Yarubuda for a round-up 1 minute talk. My president.
Thank you, Dr. Lulu. Let me remind us and put things in perspective. If you saw the slides, Claire's slides, I guess as at yesterday, about 140 million cases of COVID were recorded, nearly 3 million deaths as at yesterday. And COVID has affected 223 countries of the world. In Nigeria, we've lost people. We know that health is wealth. That's what we say, the old adage. So money and power cannot save you if we don't have good health. We've lost big men like the chief of staff in this country, senators, ministers. We've lost a dear friend of ours, a pharmacist, a fellow of the Nigerian Academy of Pharmacists, Mr. Sam Nda Azaya, who was the chairman of Leadership Principle. And so many, many more people, pharmacists, doctors have died. We cannot continue like that. In the year 2000, I think, during Obasanjo's presidency, there was a plan that was started to produce 70% of essential drugs in Nigeria, for Nigeria. That is the essential drugs that we would use to cut out fake and at least provide good medicines for our people. We can't continue like this. Up to today, where is that plan? What has happened? We have to challenge ourselves and try to get this across, be committed, and change things positively because things really are not good. Yesterday, I think it was yesterday or the day before yesterday, the president of the nation returned from England from a medical medical checkup. Why? During the pandemic, nobody could travel, no matter how much money you had. And so we expect that our first citizen should be at the forefront of driving do it at home things like healthcare. Where are the centers of excellence for healthcare? Why can't we do that? So there are lots of questions to be answered, and this particularly arising from the experiences that we have seen or have learned in this COVID era. So I hope that our conclusion and our effort, the efforts of the Nigerian Academy of Pharmacy and the Nigerian Guild of Editors would start up something to move the needle towards some self-sustainability in some areas of healthcare. Thank you very much, and I commend your team, Dr. Lulu, for doing a wonderful job. It's been exceptional information that we've received over these last few days. Thank you.
Much, my president. I appreciate you. Mr. Chairman, sir, it's your turn, sir.
Thank you very much. You lightened my burden. You made my job so easy. I've really enjoyed this session tremendously. Little did I know you'd be on for 6 days. It's incredible, unbelievable. And when I heard of some of the resource people who have been part of this whole journey, I wish I had some time, or much more time than I devoted today. But to think that I had to also sacrifice some time out at my gym this morning, I think it's been time well spent. I particularly enjoyed the paper. I enjoyed the paper by Claire. Almost I think I never knew that you had in pharmacy such eloquent and people of oratory power. I thought it was only in the media you find such people. Claire, well done. I enjoyed your paper immensely, and also the various contributions from past President Mohamed Yaro, the Emir. I think we do have a battle ahead of us. Sometimes you cannot but help to lament and wonder where we go, how we got to where we are, how things deteriorated so badly. Growing up in Nigeria as a young man and having the privilege of schooling at different levels, from primary to the university in Nigeria, and with the little exposure some of us have had, also schooling abroad, you realize that we didn't grab the bull by the horns, as they say. We were seeing the deterioration at different stages from the 60s, the 70s, the 80s. And we kept, as somebody said, playing the ostrich. We kept thinking that things would get better. You know, there was a lot of corruption, a lot of erosion of values in education, lack of investment in research. A lot of things have gone wrong. We have to start to put things right. And I think this conversation is part of the process, or we should see this conversation as part of the process of trying to get back our values, trying to reorientate ourselves as a nation, as a people. That we can't afford to watch this continuous drift in national values and pretend that all is well, because we have to look up to how we have to bequeath a nation to our children and a legacy that they can be proud of. We've talked so much about brain drain, doctors, pharmacists, nurses, all over the world. The last time I went for a medical check in UK about 2 years ago, interestingly, the consultant who attended to me happened to have been a Nigerian, one Dr. Tony Adegoke. And I was so proud of him. And we have so many of them. I believe that this nation is endowed with talent. This nation is endowed with people who are competent, qualified, different faces, different and pharmacy is not the least. I'd like to thank Prince Julius Adeluyi for this partnership with the Guild of Editors. I think we should do more of this. The conversation should be kept alive. Some of us who are executives in the media are ready to make our platform available for us to further engage the benefits of the past 6 days in whatever form, the white paper or the communique that's coming out of this. Let us expose it further. Let's take the conversation far beyond today. The event of the past 6 days, let's stretch it and see how much sense we'll make out of it for the next 2 weeks, the next 1 month. And you see, the process of change is not something that is not by happenstance. It takes planning, it takes time, continuous engagement with those who are in the position to change policies, because change is something that doesn't come easily, especially when people are used to doing things the wrong way. So those of us in the academics have a lot to do, because they say, I mean, the hand that rocks the cradle rolls the world. So we have to ensure that the children, the products that are coming out of the universities are products that can make the difference and not continuous talk shop. We have, like Claire said, we have to walk the talk. We talk too much in this country. And then you go to the rural areas. The early stages of COVID, I happen to be the president of a social philanthropic club. I can't recall how much we spent in terms of engaging people to spread the message to the nooks and crannies of Nigeria in local dialects. Because it took a while for people to believe that, even as we speak, a lot of them don't believe in COVID. And last Christmas, I spent a few days in my country home, and I saw the nonchalance. They saw those of us who are wearing face masks like people from outer space. So there is quite a lot of work for all of us to do in terms of taking these messages to the truth, so to let people believe that, hey, there is something called COVID. And this is how it affects you as a person. Last Saturday, I engaged my in-law who lives in New York on Long Island. And I said to him, how is COVID in New York? He said, hey, we have the British variant now. And in one day, we recorded the highest number. And that was last Saturday. And but here we are, some people giving the impression that in Nigeria, oh, COVID is over, we might as well stop mask, life should be back to normal. I say, no, it's not over. It is not over. So this conversation, I want to plead the Nigerian Academy of Science and Nigerian Academy of Pharmacy. We need to take it higher. The various brilliant expose papers, contributions for the past 6 days. Let's put the high points together and further engage the media. And please, you can always my support, President Adili, as we take this message, the key messages arising from this 6 days discussion to every nooks and cranny of Nigeria. I thank you, and I've been proud to be part of this. And please, let's keep it going. Thank you.
Thank you, sir. Please, a round of applause for our chairman. I want to see you clapping for the chairman. I want to see you clapping for the chairman. Thank you very much, sir. You've said it all. And who is that right person to respond to you and to all here, other than my boss, as the Group Managing Director of Leadership Newspaper? The floor is yours now, sir.
Thank you very much, sir. I said it before that you are my pretense that I'm your boss, but that's okay. My most profound respects to my Lord Pharmaceutical and our father, both in pharmacy and in journalism and in the profession, Prince Julius Adeluyi, past presidents on this call, the president of the Guild of Editors in absentia, the various chairmen of sessions, the chairman of this particular session, my good friend and brother, Mr. Tony Akiotu, who is the Group Managing Director and Chief Executive Officer of DAR Communications. Without further ado, because I know that the day is already fast spent, I think we've had a lot of speech making in the last 6 days. Now I think it is the time for doing. And I do hope that after this call, as the chairman of this organized group, Sir Ifeanyi Atui, had said before he departed, that we will sit down both as pharmacists, as healthcare providers, as journalists, to actually walk the talks. The keynote speaker, pharmacist Claire Omasheye, has said during her most eloquent and insightful intervention. That is what we need to do. For me, the last 6 days have been 6 days of extraordinary learning experience, 6 days of advocacy, 6 days of expanding the network, of meeting new people, forging new partnerships. I believe that what we need to do going forward as a journalist and as on this call is to find a way to force and make the change happen that we all desire. Once again, I'd like to thank everyone and hope that the conversation will continue after this call. I thank you all very much indeed.
So very much. Thank you very much, Azu. God bless you. Well, it's nice to see that even at closing, we still have the house full, which is a very good one. 90 people in the house. So let me call on the president of the Nigerian Academy of Pharmacy to speak to us in rounding up.
Distinguished ladies and gentlemen, what a day we have had today. We are discussing lessons learned, and by some kind of coincidence, the chairman of this occasion, the guest speaker of this occasion, the moderator of this occasion, All the three of them are COVID graduates. And it's going to be difficult to tell them that COVID does not exist. I say this because earlier in the week there were very many people with strong opinions, strongly held, who kept putting on the chat box that they would not take the vaccine and that COVID does not exist. What a way of closing this discussion week-long on COVID-19. What way can be better than to have those leading the session who are all COVID graduates? I congratulate all the graduates. Particularly impressed by the chairperson, Negwe Anthony Kyoto. We were very worried about you when we knew nothing about the COVID. Go through all that experience, but you resurrected. All of us know about the AIT. It was started, launched on November 1996. And Raymond Alego, Dokwesi, will be the first to tell you, nobody knows the trouble I have seen. Anybody who is running a business in Nigeria especially suffers without being celebrated. I'm saying this because where would the AIT have been today if we didn't have Tony Akioto here? And Tony, you know what I'm talking about. You know how many sleepless nights you've been through. And you know how you've been packaging a very calm surface when the mind is right. But please go on with that particular SME because it's a poster SME for Nigeria and Africa. And give our democracy our best regards. And we hope we'll also partner with you with the fullness of time. Now, why do I say so? For 6 days we've been talking COVID, the pros and the cons. Let me start by thanking the Nigerian Guild of Editors. Our discussion to have a partnership with them would not have worked if we didn't have someone like Azu, who just spoke now. And we are fortunate that the partnership has worked. And I think that the partnership is only just the beginning of further partnerships. We're going to extend it because we have found out that just complaining about the situation is not enough. Government cannot answer all the questions. Education is an emergency. Health is an emergency. Everything is an emergency. So we have to take care of our own situation. That's why we started this move. And the last 6 days have been very, very illuminating. It has shown that Nigeria can engage intellectually. We in Nigeria can identify the principal contradictions. We in Nigeria can confront directly the problems and perhaps reset the system to bring some desirable results. Because we Nigerians have the genius, we have the authenticity, and we have the creativity, the creativity to be able to get results. That's what leads me to the guest speaker of today. The guest speaker of today, Clara, is just as well that you are the speaker, and we are not surprised. People look at you and appreciate what they see. But if they studied you, they will know that what they see is less than what they get. Because you are a deep researcher, and you grow younger as the years go by. And we know that clarity is your mantra. Your views are clear, the views are expressed, and your achievements are clear to one and all. Your points have been taken, We know that you are an expert on PP, passionate about it, and we would partner with you in this. But we know you're also very passionate about improved healthcare in Nigeria. Don't be frustrated. Don't be disillusioned. Sometimes when you feel lonely, talk to the Academy of Pharmacy. There you will find a whole lot of diamonds waiting to express themselves and support you. Since this is the last session, I'm thanking all the speakers who have given us aspirational, motivational, and inspirational lectures. We've had some more knowledge. Some people's perception have been changed, and attitude to COVID also revised. Today we had somebody who spoke like an apostle, who in the last 3 days had been very, very opposed. He has been changed from Saul to Paul. And that's what this kind of engagement should be all about. Listening to points that are contrary and accommodating, and then reaching an agreement. Because we find, ladies and gentlemen, the moving parts of the healthcare machine need to be retooled, reset, and in fact, reapproached. I believe, ladies and gentlemen, that we've had a very good week, and what we've discussed today has been made more available to people through the activity of Alhaji Muhammad Yaro Buddha, himself a pharmacist and a philanthropist, but also a farmer. Each time I think about him, I think about his NIGERIAN group, and I hope that the herders are not too close to him. But talking generally, therefore, we've had people, traditional rulers, like the Emir of Bungudu. We appreciate you, Your Royal Highness. People want to listen to traditional rulers and expect some kind of low-grade contribution. But your past reflects on you. You have been secretary to a state government, and therefore the points you have made have been very, very, very acceptable. We shall be in contact with you, Your Royal Highness. You've done well. We've had pastors here who have also said the COVID thing doesn't exist. It's related to 666, and they are going to become a vampire. But we must be patient to listen to the opposite side. We should not be seen as an organization that is here jumping to defend government. In fact, during the week, we had people in the chat room saying that this is hosted by government. And we have said to them, we're too big to be sponsored by any government. Not a government that is printing whatever they print to make their finances balance, or a government that came in too late to even pay for sports. We couldn't have been sponsored by anybody. We're a group of people concerned, like Claire, about finding ways to make the health of the people better. Not just rhetorics, but action. We also mentioned the need to excite the private sector to make sure, as somebody quoting Churchill said, that this COVID experience does not waste. If it should come next time, we should be better prepared. We've asked the government to prioritize on funding. And we've also, they must seek knowledge before they take a decision and have an attitude towards something like COVID. Rumors, fears, and such things would not work. We hope that all of you who have been here today, there's still about 80 or so people here. We hope you have enjoyed your time. We want to assure each and every one of you that the conversation over these 6 days have just started. We would have some more engagements with people, and we would involve more religious people, more politicians, more academicians, and influencers to make sure that this whole thing is well addressed. And before I round up, there's somebody to my right. His name is Obaloluwa Ojo. Once in a while, a profession has someone who is dedicated and who delivers. Such is our director of organization for the Academy of Pharmacy. And I would respect one of us to give him an applause. He has dedicated his whole life this last month or two to seeing to the success of this. It's not the money you get, but the appreciation you get from people. You can see all the hands clapping for you. So, ladies and gentlemen, I wish you well, and I know that Nigeria may be a country where the best doesn't happen, but the worst is impossible. So we shall survive, and the resurrection of Easter will strengthen us, and all your comments will come to realization, and with better research and development in all subjects, Nigeria is on to a greater future. Thank you. I think we then go through now to giving some things. The chairman, Tony, are you there? Let's see your hand receiving this particular plaque. Stretch your hands out. No, don't wave, just stretch both hands out as if you're receiving. Aha! We give thee this particular plaque in appreciation of your very active, even proactive approach to this matter today. You remember you started on your own without haste. So, will thou take this via email? Just download it when we send it to you. Then we also have another one for our guest speaker, Pharmacist Claire Omatsaye. Omatsaye. Are you also seeing it, Claire? Yes, and I like the way you are receiving it. Much better than Tony's approach. That'd be good for you. What's the next one? Mohammed Yaro Buddha. You have had this opportunity of chairing as a moderator the discussions for the last session. Stretch thee thou thy hands to receive. Thank you very much. Who's next? Okay, we have two. There's Dr. Sami Koku. Sami Koku, you are in the US at this point in time, right? Good. We will keep this here. Are you in the US?
No, I'm in Abuja.
Oh, how disappointing. You will get somebody to get this to you, Sami Koku, and you've spoken very well. And finally, Professor Ray Ozalwa, for your very brilliant, no, you are stretching too quickly. We know you are a pharmacist. We know how bright you are. You are the kind of person we're going to involve in the future. Please keep firing.
Thank you, sir.
We're very proud of you.
Thank you,
Again,
sir.
I repeat that we are fortunate to have the Nigerian Guild of Editors to partner with us in this. It's been a wonderful week of experimentation, but it has ended with fantastic achievements. It is the beginning of a long-distance conversation. Please come on board as we continue this journey. Thank you very much. We may now round up with the national anthem, etc.
Okay, thank you very much. I think the president deserves your round of applause. Please, let's keep it moving. Thank you so much. Even at closing, we have 75 people in the house. That's really great, really great. So, we still have a closing prayer. So it's going to do that for us. I think I see a Nuruddin Usman in the house. Are you there? Ah, okay. Your Royal Highness, I think it would be good for us to have the prayer from you. Is he still in the house? Oh, yes, sir. Aha, royal prayer to round it up. The final one.
Yes, I am. I pray to God Almighty in His benevolence, especially in this auspicious moment of fasting, to bless each and every one of us and to reward all of us for the contributions we have made. I pray that everybody who has come far and wide be taken back safely. Those who are within the confines of their homes, like I am, may the Almighty bless you and your family for the service to the nation. Allahumma asin aqibatana fil umuri kullaha wa aljina min khizyi adhabil akhirah. Alhamdulillahi rabbil alamin arrahmanir rahim maliki yawmiddin iyyaka na'budu wa iyyaka nasta'in ihdinas siratal mustaqim siratal ladzina an'amta alaihim ghayril maghdubi alaihim waladdallin. Thank you very much. Assalamu alaikum.
Amen. Thank you, Lord.
Thank you so much. Thank you, everybody. Thank you, Ernest Okafor. Thank you, Lawumi Peters. Thank you, Bisi Okpanuga. Thank you, Joma. Thank you, everybody, for coming around. We appreciate you. Today is the last day, but like it has been said, it's just the beginning. It's just the beginning. We promise you. Oh, my boss, you are here, Mr. T. Mr. Tayo Murungeji. Nice to see you. Thank you, everybody. God bless you. Bye-bye.
Long live the Academy of Pharmacy. Long live Nigeria, our nation. It's going to work. You ain't seen nothing yet.
Thank you, sir.